Good afternoon. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, with our briefing for Friday, May the 29th. This brings us to the end of the 12th week of the coronavirus here in Montgomery County. Since our briefing yesterday, 81 new cases of COVID-19 have been reported in Montgomery County, which brings us to a total of 6,859. These positive cases are a result of a positive test for the virus, not from the antibody test. Today, 17 of these cases are from long-term care facilities. 1 is from the Montgomery County Correctional Facility, and 63 are from our community. These positive individuals are from 26 municipalities. 61 of 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 1-year-old to 98 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographical information. Today we have 38 females and 43 males. None are hospitalized, 6 are known to be at home in isolation, and 75 are unknown in terms of their status. I'm also saddened to confirm that 2 more Montgomery County residents have lost their lives to COVID-19, which brings us to 677 deaths confirmed positive from COVID-19. Both of today's individuals passed away in a long-term care facility. They were 90 and 91 years old. In total, we've had 367 females and 310 males lose their lives to COVID-19. The self-reported racial breakdown as we have it: 16 Asian, 3 Asian Indian, 2 Asian Korean, 83 African American or Black, 227 white, and 346 unknown. In terms of probable deaths today, we have 114. So added to our confirmed positives, that brings us to a total of 791 deaths. Now, as a reminder, probable deaths are deaths that have COVID-19 on the death certificate, but we do not have a confirmatory lab test. If we do get that test, then we move that individual to the confirmed positive count. Our hospital beds are in a little better shape today. We are now back down to 225 COVID-19 patients in Montgomery County hospitals. That's a decrease from yesterday's 250, and approximately 23% of those individuals are requiring ventilators. 94 of our long-term care facilities continue to have exposure and report cases of COVID-19. These are cumulative totals since we began this self-reporting effort. We now have a total of 1,878 cases among residents and 687 among staff. Just a reminder that not all of these individuals are Montgomery County residents, so these totals are not necessarily part of our official county total. We continue to work closely with these facilities. I'm very pleased to show you in a few minutes on our updated, some updated graphical information that cases in these long-term care facilities are coming down quite a bit. So we're so grateful to all of the staff and individuals who have been working at these facilities. They have done a great job of helping these residents and get this situation under control. In terms of deaths associated with long-term care facilities, 568 of 677 confirmed positive deaths have been affiliated with long-term care facilities. So that's 84% of our total confirmed positive deaths. In terms of our Montgomery County Correctional Facility, as you may recall, approximately about now 12 days ago, one inmate from a group of inmates that had originally tested negative for the coronavirus developed symptoms and tested positive. So we retested all of the inmates who had previously tested negative. We did not retest anyone who was already known to be positive. These were just individuals who were negative. And a total of 716 inmates were tested. Yesterday, I reported that we had tested 718 inmates, but there were a couple duplicates in there. So the correct and confirmed number is 716. 93 inmates to date, which is 12.8%, have tested positive. We are still waiting on results for 15. All of these individuals have been isolated and their contacts quarantined. Currently, all inmates that have tested positive for COVID-19 are stable. The entire staff at the Montgomery County Correctional Facility is in the process of being retested right now, and that's anyone who was previously negative for the coronavirus. That testing should finish tonight, and we will share those results with you when we get them next week. In terms of our community testing sites, both the Pottstown and the Norristown sites were closed today because of the weather forecast. The Pottstown site will be open on Monday, weather permitting, from 11 a.m. to 1. That site is at our Office of Public Health, Pottstown Health Center, at 364 King Street in Pottstown Borough. To make an appointment for Pottstown, you can call Monday morning at 8:30. The number is 610-970-2937. Our Norristown site will also be open next on Monday, weather permitting. And that site is at the Delaware Valley Community Health Center. You can make an appointment for the Norristown testing site on Monday morning at 8:30 a.m. by calling 610-592-0680. And the Montgomery County Community College drive-through site was open and running smoothly today. And again, just a special thanks to the Community College, Whippane Township, their police department, the Pennsylvania National Guard, and the many county departments that have been assisting at that site. For the dates between April 16th and May the 23rd, we have tested 7,075 individuals. We've received results on 6,931 individuals, which is 98% of the total. 950 of these individuals have tested positive. So for these 32 days of testing, we're now running 14% positive. This site, the drive-through site, will be open tomorrow, Saturday. You will be able to start making appointments at 8 a.m. tomorrow morning. You can do that online at moncopa.org/COVID-19 under the green County Testing Information button. Or also beginning at 8 a.m., you can call 610-631-3000. This site will be closed Sunday for a safety stand down. As a reminder, both CVS and Rite Aid are offering no-cost testing for people 18 years of age and older at several locations in our county. You can see an updated list of these locations at moncopa.org/COVID-19. First, click on the County Testing Information button, then click on Testing Sites Map, and there's information there. So as we come to the end of week 12, I want to give a very special and very heartfelt thanks to a county office that has been working incredibly hard with little recognition during this pandemic. This office, our county coroner's office, is not one that most people are eager to get to know, but they have played such an important role during this pandemic. Overseen by our coroner, Dr. Michael Milborn, First Deputy Coroner Alex Balaki and his team have investigated 881 total deaths since March the 22nd, when the first Montgomery County resident was lost to COVID-19. This has been an enormous and very difficult amount of work, and I want to thank them all for their dedication and professionalism to this task. Some additional announcements. First, sheriff sales. The previously rescheduled May 27th, 2020 sheriff's sale, which had been rescheduled to July 29th, has now been moved to August 26th, 2020 to comply with COVID-19 public safety and mitigation efforts. On August 26th, the sheriff's sale will be conducted using an online auction format, the details of which are to be announced once finalized. In the event that the August sale can't be conducted via an online auction, it will take place in person at the Montgomery County Fire Academy at 1175 Conshohocken Road, Conshohocken. But I do want to emphasize the intent is to hold this August 26th online. An announcement about gun permits, also from our sheriff's office. In accordance with state and county-wide reopening directives, the Montgomery County Sheriff's Office will resume issuing license to carry firearms permits on June the 9th at the Montgomery County Courthouse at 2 East Erie Street in Norristown. Permits will be issued by appointment only during limited hours. For more information about the sheriff's sales or gun permits, please check the Sheriff's Office website at moncopa.org, select Departments, and then Sheriff's Office. Now, I know that everyone is anxious to get out and support our local businesses that have been through such tough times and whose owners have made such incredible sacrifices during these past 12 weeks. We're still at least a week away from actually being able to get out and visit some of these businesses. But what you can do this weekend is purchase a gift card through our Montco Strong gift card program. Go to montcopa/COVID-19, click on the green Find Your Topic button in the upper left corner of the webpage. Then click on Business and Workers. And then you'll see the ability to click on Montco Strong Gift Card Network. There you will see a large number of local businesses who would be so grateful for your support through the purchase of a gift card. So please consider that this weekend if you're able. Now for today's graph, we have updated through May the 24th our graph of daily cases and running averages by date of test. The gray bars are the number of positives on each day of testing. The red lines, so one is darker red and one is pink, are the 14-day and 7-day averages of all cases. The dark red line is the 7-day average, and the pinker line is the 14-day average. Just below that are two blue lines. This represents our entire community count. So the darker blue line is the 7-day average, and the lighter blue line is the 14-day average. Now we've added something to our community counts today. We've added a dashed line, and that equals the community count minus any positive individual in a correctional facility in Montgomery County. So the majority of those individuals are from the Montgomery County Correctional Facility, but we do have a handful of individuals from SCI Phoenix. So if you look at the dashed lines, which are lower than the total, the dark blue dashed line is the 7-day average of our community cases with the correctional facility inmates subtracted out. And then the lighter blue dashed line is the 14-day average of the same. And then down toward the bottom, you'll see a yellow and an orange line, which represent our long-term care facility numbers. That dotted line, kind of going through horizontally through the graph, represents the metric of 50 cases per 100,000 residents. So starting at the bottom and working my way up, if we just look at the 7-day average, at our long-term care facilities, they're now running 12.3 cases per day. We are so pleased to see this because we all are very aware of how serious the situation we have been dealing with in our long-term care facilities. So we are pleased that our interventions and support and help seem to have been of some assistance to these facilities. Then working our way up, the dark blue dashed line, which is our community cases minus any inmates, is at 55.9. The dark blue line that includes the inmates, so that's the 7-day average of all the community cases, is 67.7. And then our dark red line, which is all of the cases together, including long-term care, community and correctional facility, is running at 80. So these are numbers that are robust, are holding steady. And as we move into the yellow phase, I just want to remind everyone that we still do have this virus in our midst. However, I think if everyone behaves responsibly, we have a sufficient infrastructure in place now that we will be able to identify hotspots of cases and offer support and intervention and do sufficient contact tracing to track down any direct contacts of individuals that are positive and urge them to go into quarantine. We have consistently increased testing ability, and in fact, as of June 1st, our community-based testing sites will be able to go from a total of 250 tests across our 3 sites to a total of 350 tests across those sites. And we hope to be announcing fairly soon a plan for more test sites around our county. So stay tuned for that announcement, hopefully next week. So as we put all of these pieces into place, it will allow us to live with this virus, which we are going to be doing for the foreseeable future. So I just want to remind you one more time of how important it is that we all follow the guidelines for social distancing. We need to cover our sneeze and our cough, keep our hand hygiene top-notch, keep our distance from others at least 6 feet when we're out in public, and be sure to wear a mask when in public. Just a reminder that wearing a mask helps protect others in case you are an individual who has no symptoms but are positive for COVID-19 and are contagious. That's one of the things that we understand now that we did not understand at the beginning of this pandemic, is how many people are spreading the disease but have no symptoms. So these are the steps that we need to take to stay safely in yellow. We have posted quite a bit of guidance at our Data Hub site at the montcopa.org/COVID-19 site. There's a new button at the top of the page labeled guidance, and you can click through that, and there's just a wealth of information there about safely reopening. We want to responsibly reopen and make sure that we stay safe in this yellow phase, and make sure that we can get folks back to work and keep our eye on the goal of getting our kids back to school this fall. And with your help, I am certain that we can get there. So with that, I will turn over to Commissioner Lawrence.
Good afternoon. I'm going to speak today about the election, but actually about our 5 secure ballot drop-off boxes that are available throughout Montgomery County to ensure that your ballot is received by the June 2nd, 8 p.m. deadline. These locations that I'm going to discuss are open every day throughout the weekend, up into and including Election Day. And if you have not already mailed your ballot, we strongly encourage that you use this option. The ballot drop-off locations are staffed with county security and are equipped with video surveillance. Ballots returned to the secure drop-off boxes will be delivered to voter services daily and time-stamped as received, just like ballots received in the mail. Completed mail-in ballots and absentee ballots may be dropped off at any of the times listed for the location and must be placed in the drop-off boxes by 8 p.m. on primary election day, June 2nd. However, I want to emphasize again, you do not have to wait until June 2nd to drop off your ballot. If you're using one of the secure drop-off boxes, you can only return your own voted ballot in the box. The Pennsylvania Election Code does not permit anyone other than the voter to return their mail-in ballot. The ballot drop-off locations are located in and will be open every day, and including Election Day, in Norristown at 1 Montgomery Plaza, 425 Sweet Street, Green Lane in Green Lane Park, Lansdale at the Montgomery County Community Connections Office, Pottstown, Montgomery County Community College, Pottstown Campus, Willow Grove at the Eastern Courthouse Annex, and you can find complete information about the locations, hours of operations, and whether it's a drive-up or a walk-up site on the Voter Services website at www.mongopa.org/voter-services. And I also want to remind everyone planning to vote in person on Election Day to please check your polling locations, since we have consolidated locations for this election only due to health and safety measures due to the COVID-19 pandemic. For more information about the updated polling locations, you can please visit www.mongopa.org/voter-services. And with that, I'll turn it over to Commissioner Gale.
Thank you. Good afternoon, everyone. This is Commissioner Joe Gale. This being one of the last press conferences we'll have before Tuesday's primary election, I just wanted to provide an update and suggest to those, many of you who have contacted our office with problems regarding your mail-in ballots, that an easy option is to vote in person on Tuesday for the primary election. You can go to your judge of elections at your polling location and request what is called a provisional ballot, and you can vote in person with a provisional ballot. So this is an option that some residents of Montgomery County are not aware of and could be an option for you. I apologize for the handling of this election. I've been very critical of mail-in voting for several months now. From day one, I've opposed mail-in voting. I've pointed out that it could be extremely problematic, and it's turned out that it has been extremely problematic here in Montgomery County. There's thousands of voters that have not received their ballot yet. There's thousands of voters that have received incorrect ballots. There's thousands of voters that received instructions that were not correct, along with a wrong ballot. And I just today have received calls from people that have received ballots that are for the wrong party affiliation and not even for the correct municipality. And this is very challenging for those voters because of the time-sensitive nature of the upcoming election being so close. An option, if you're in town and you're not traveling, is to go vote in person. In my opinion, voting in person is the most direct way to vote, the most secure way to vote, and it's also the easiest way to vote and exercise your civic duty. So for those of you that are not aware of the various polling locations and the consolidation plan that's taking effect for the primary this year, please visit the county website, mongopa.org. On the home screen, you'll see a link that goes to the Voter Services Department, and there you'll see another link where it says Find My Polling Location. You can type in your address and find where your polling location will be for this primary on Tuesday. I've also been informed today that a letter is being mailed out to all the voters in the county informing them of these location changes. I'm also disappointed that this letter is dropping so late to inform the voters in Montgomery County of the changes. The consolidation plan was passed 2-to-1 vote several weeks ago, and that's the time when this letter should have gone out to the voters. So it's been very problematic, very confusing for the voters in Montgomery County. I apologize for the inconvenience and disruption this has occurred, and it's my hope that in the future we improve significantly the way elections are conducted in Montgomery County. And with that, I'll turn it over to the press for questions. Thank you.
Thank you. This afternoon, we're joined by Todd Sheppard from the Delaware Valley Journal, as well as Carl Hessler from the Pottstown Mercury. And we will start our questions with Todd.
Thank you. The question is for Chairwoman Arkush. Madam Chair, I'm trying to get some information on the timeline of some things that the county has done, and specifically I'd refer to comments you made in a May 6th meeting with the Senate Democrat Policy Committee. At that time, you said, "We conveyed our concerns to the PA Department of Health in a couple of phone calls." And I'm wondering if the county can tell me, and I would add, I don't necessarily need the answer today because I realize there may be some research here, but I'm wondering if the county can tell me what were the dates of the phone calls that expressed concern to the PA Department of Health about the number of cases and deaths in nursing homes. Also in that,
I don't have those dates at my fingertips, but certainly we can get back to you on that.
Sure. And again, I would also add, I submitted these questions earlier in the week and I didn't get a response from the county, which is why I'm asking them in this forum. So I apologize for that.
No problem. We'll see if we can get you those dates.
You also said, however, it did become clear there was no capacity to make on-site visits to these locations. So as a county, we decided it was the right thing to try to do to take this on ourselves. So our staff formed 6 teams. We call them FAST teams. And so I'm also hoping to get, I'm hoping to know, when did the county convey, or I'm sorry, what day did it become clear there was no capacity to make on-site visits by the Pennsylvania Department of Health? What day was the decision to create the FAST teams, and what days, or what was the first day that the FAST teams were deployed? And again, I don't need an answer to any of those right now. Thank you.
No problem. We'll get that to you.
Thanks, Todd. Next, we will hand it over to Carl Hessler.
Carl, are you muted?
Can you hear me now?
Yes.
Sorry about that.
No
Thank
worries.
you. Dr. Arkush, have the strike teams from the state gone into the long-term care facilities this week? And can you now identify those 4 facilities that were supposed to be visited by those strike teams?
So the information that I have is that one team, and they actually ended up coming through FEMA, but I think it's all part of this same program. I made a visit, I believe it was yesterday afternoon, to 2 facilities in the Living Branches organization. And that is all the information that I have. I have not gotten an update on those visits.
Do you expect to get an update from state officials on that?
I don't know if we will or not.
Okay, I have a few election questions. This morning, I interviewed a couple from New Hanover Township who just received their mail-in ballot yesterday, and it was the wrong party designation. They're an elderly couple who both have severe medical conditions, and they cannot vote in person. They are very, very scared to be out at a polling place because of their medical conditions, and they will not be able to vote in person. And I was told that for the first time in 35 years, they will not be able to cast a ballot, and they're just infuriated about it, and they're very disturbed about it and upset. What do you say to that type of voter who cannot vote in person on Tuesday, and in essence fear that they are going to be disenfranchised because of the snafus in the election office?
Well, I'll start, and I don't know if my colleagues will want to add. I would apologize to those voters. There have been unacceptable errors that have been made during this process, and that has nothing to do with the mail. That's something that should have been controlled and should have been caught, and it shouldn't have happened. So I would apologize to those voters. We need to figure out how it happened, and And that cannot happen. We can control what goes into the envelopes. And in this case, it seems that that did not happen, and it's unacceptable, and I would apologize to that couple.
And there really is nothing else they can do if they do not choose to go to the polls in person on Tuesday. There's nothing else they can do if they do not receive an updated mail-in ballot between now and Tuesday morning, I guess. Is that true? And the other part of that is you had gone to the Commonwealth Court to try to get an extension. Has anything come through on that?
We haven't heard anything on our appeal to the Commonwealth Court.
So that basically would be the only option that a couple in that predicament would have. It would be that if the deadline to file your vote would be extended for those 7 days.
Yes, get an extension so that as long as it was postmarked by June 2nd, we would have up until a week then to count those ballots.
How many, do you have a total number of how many ballots went out that were not correct, that did not have the correct party on them?
I don't have that exact number. I don't know if our chief clerk, Lisa Altiziak, is on and has that number.
I do, Carl. The number of incorrect ballots that went out was 1,984 ballots. The universe of voters, obviously that's a sobering number, but we were able to identify what the universe of voters was, and new ballots were mailed out, corrected ballots. So that couple should have or should be receiving a new ballot. We can talk offline. I'm very happy to follow up on the status of that ballot they should be receiving.
Yeah, they only received their original requested ballot yesterday, and it was wrong. So is the Commonwealth Court petition still in place? And you just haven't heard anything about it yet?
That is correct.
So you're waiting for a decision on that?
We are.
And anybody else who receives a mail-in ballot and this weekend or Monday and instead chooses to show up in person, what is the process they actually have to do? Is it they have to file a provisional ballot, seek a provisional ballot at the polling place?
That is correct. Anyone who has applied for an absentee or a mail-in ballot and does ultimately show up to vote in person will need to fill out a provisional ballot.
Okay.
Provisional ballots on hand at every polling place.
And Mr. Lawrence, can you just sum up the troubles that the county faced given this pandemic? Was this the most problematic preparation for an election that the county has ever faced, and was it all due to the pandemic that everybody is now enduring?
Well, I think in some ways it was a perfect storm. This is the first election where there is widespread mail-in voting. We've received over 161,000 applications, and we've gotten all those applications out. But by comparison, in 2016, I think the number of absentee ballots at that time was 9,000. So there has been a tremendous upsurge, but we are focused and remain focused on making sure people get their ballots and creating opportunities for them to get those ballots back in. I believe we have over 70,000 ballots that are already in. They're coming in every day, and that's the focus. But can there be improvements for November? Absolutely, and there will be.
Okay, that's all I have. Thank you.
Thanks very much, Carl. We are now joined by Jim Melwert from KYW. Jim?
Kind of following on what Carl just asked, can all the problems be blamed on the pandemic and the new mail-in and Act 77, or as you look at this, are there issues that happened in the office that were beyond those?
Now, there are quality control issues that were within our control and were not, that need to be corrected and cannot happen again. The issue of people getting the wrong party has nothing to do with the pandemic. It's an error, and it shouldn't have happened.
And for Commissioner Gale, you mentioned you voted against these things, but beyond that, can you talk about what you've done or what you recommended specifically amid the pandemic, especially for people who like Carl mentioned, who can't vote in person, who may be locked down, people in nursing homes or in long-term care facilities who are basically stuck in their rooms?
So the elderly couple that Carl referred to, that's the type of individuals that should request absentee ballots as a form of voting. It's my belief, and I've said this time and time again, that citizens should exercise their civic duty by voting in person because it's the most direct and secure way. And traditionally, that's how elections have been held for decades in our nation. So it should have never been, we should have never had this high volume of mail-in ballots. This is a historic level of mail-in ballots. And on top of this, this is the first time that we've outsourced the handling and the mailing of mail-in ballots to voters. Before, this used to be done in-house by the Montgomery County Voter Services Department. So this outside company, we were unfamiliar with their job performance. We've never done it before. It turned out to be a total disaster. They should be held accountable. I opposed that contract, which was nearly $1 million to this firm out in Ohio. The whole process has been a disaster. And the primary has been pushed back from April to June. That should have allowed enough time for the proper preparations to be made to have a smooth and effective election, which has not happened in Montgomery County. So it's disheartening that we have to tell voters that there is a more than likely chance that their vote will not be counted in this primary. And it's because of the lack of leadership from the top to the company that we outsourced the handling and the mailing of the ballots to in Ohio, their failure. And this isn't the first time, Jim. We've seen it in 2016 when hundreds of ballots went unaccounted for in the general election. If you look back in the history of the Montgomery County Voter Services Department, I believe in the last 6 years, we've had more than 4 directors of voter services. It's a position that people that take it have a hard time dealing with it. This is nothing new, and this is something that I've been voicing my concerns with since my first year in office as county commissioner. So I've been fielding those calls from constituents in Montgomery County, similar to that elderly couple, because when they do call voter services, they get no answer. So on top of all this confusion and chaos, they don't get an answer and they can't get a hold of a human being or response in an email when they express their concerns and share their problems. So I've been fielding as many phone calls as I can, trying to explain to some people that they have the option to do the provisional ballot in person on Tuesday, but unfortunately that option is not suitable for many residents in the county, particularly those that have health conditions and don't want to go to the polls on Tuesday.
So something like the Ohio contract, or the contract that was awarded to the company in Ohio, what was would you want that to be in-house, or what did you think should have been done with that? I
think that it should have been done in-house where you have more oversight over the process. And we shouldn't have had such a massive push to encourage the voters in Montgomery County to vote by mail. Every day at the press conferences, you heard from the leadership in this county, not myself included, that voting by mail is a good option for voters. It's an easy option for voters. You can do it from the comfort of your home. And all along, I've been saying, no, mail-in ballots are very problematic and lead to a disaster in the outcome of an election. So we have an obligation as a county government to deliver an election, every primary and every general. This is not the first time Montgomery County has failed at it, and I've been very outspoken about this for many years. But unfortunately, we continue to head in the wrong direction, and I hope this is a learning experience for my colleagues and everyone, that mail-in voting is not the best option. We should have a traditional election where as many people vote in person as possible. And for those that cannot vote in person because of travel or illness or any other circumstance, then an absentee ballot is the proper option for those. But we can't encourage all the residents to do mail-in voting because this is what happens.
And understanding that with the pandemic, and I'm sorry, I don't mean to waste time here, but with the pandemic, and you said you voted against the consolidation of polling places and you're against mail-in ballots. What would have been, in your opinion, the appropriate solution here? What else could have been done, or what should have been done?
Well, consolidating the polls, I opposed because there were members of the public that attended our election board meeting that came in person to the meeting and had a solid argument that there was changes made to the polling locations in West Conshohocken Borough and Abington Township and Rockwood that I thought made sense and I thought was a better option than what was presented as the consolidation plan. That's the reason why I voted against the consolidation plan that was put forward. So I think the best option would have been to have a consolidation plan where we had proper input from the public, and also not to push so heavily encouraging the voters to vote by mail. Instead, there was hysteria created all along this process around the coronavirus at an unnecessary high level. So I think we could have focused on long-term care facilities, those residents, providing them mail-in ballots. Obviously, that's a vulnerable population. We all know that. And then for the general public and masses, we should not have had so much hysteria around COVID-19 and encourage people to vote in person. So it's been mishandled from the very beginning.
I'm good. Thanks, Todd.
Thanks very much, Jim. We'll now go to Teresa Harris with some questions from reporters who couldn't be here with us this afternoon.
Okay. Today, our first question is from Kevin Tierney from Burb Media. He asks, at least one county official has been posting on social media advertising open positions connected to the June 2nd primary. How many judge of election positions need to be filled, and how many other positions besides that?
I can answer that, Kevin. Poll worker recruitment, it's just one of the many challenges that counties all across the Commonwealth have been facing here during the pandemic. So recruiting poll workers and retaining poll workers has been a challenge. We've got approximately 300 judges confirmed for Tuesday's election and approximately 700 poll workers. So there is still a need for additional poll workers. We continue to recruit, and we will straight through Election Day. In an effort to retain, I would add, in an effort to retain poll workers and to recruit others, the election board did vote to double the pay for poll workers for this election, acknowledging the challenges that exist. So judges will get paid $300 for the day, and poll workers will be paid $225 for the day. Training is available online, and obviously we're available to help explain the process. If folks are interested, I'll put a plug in that they can send an email to voters@montcopa.org, or they can call 610-278-3278.
A second question by Kevin Tierney at the Burb. Is there time to train people who may accept these positions by Tuesday morning?
Yeah, we do. We have made the training materials both in video and in a PowerPoint online, acknowledging that both there are in-person training constraints and also time limitations. So we do believe we've got the materials available. And I would say to any poll workers listening, I would just give them a personal thank you for stepping up under the circumstances for this primary election. It will be a team effort at every one of these polling places. There will be polling places that are sharing poll workers, and they will need each other all day long. And I think poll workers are a tight-knit group. I hope that they will look out for one another and help one another. I'm certain that should anyone have a question at their polling site, there will be another poll worker there to lend a hand. But the materials that people will need are available. We'll make sure they get them before Tuesday if they need them.
A question from Deanna Durrani at NBC 10. You mentioned that the coroner's office investigated 881 total deaths since March 22nd. Besides deaths attributed directly to COVID-19, do you have any information on increases in other death classifications, such as overdoses or suicides, that could have happened as a result of the social impact of the pandemic?
Yeah, that's a good question. So I actually asked the coroner to look at that about 10 days or 2 weeks ago, I think, at this point, and also checked in with our suicide prevention task force leadership. And at least as of that point, there was not the sense that we've seen an increase in death by suicide. But I can't tell you that that won't become apparent, with a little more additional time, but there didn't seem to be an obvious trend there. We do not have much information yet on deaths due to opioid overdose. The reason is that all of the testing that has to go out to the labs to confirm blood levels of various opioids typically takes 4 to 6 weeks to come back. So we're just getting information from the first quarter of this year. In fact, we just got the 2019 data completely finalized. So again, it will take us some time to pull that together and have confirmatory evidence of that. But once we do have that, it's obviously been something I've been very, very concerned about. Once we do have a sense of what that looks like, we will share it. But it will be some time from now in the future.
Thank you. Unless there's any other follow-up questions, that's all that I have.
Okay, so if we're done with the questions, I want to let you know that we will not be releasing a press briefing over the weekend. So Saturday and Sunday, you will not be hearing from us. And we will be back on Monday at 3. Right now, the schedule for next week for live press briefings or virtual press briefings is planned for Monday, Wednesday, and Friday. That could change, but for now, that's what we are planning. So no briefing over the weekend, or no press release over the weekend, and then virtual briefings next week, Monday, Wednesday, and Friday at 3. So thank you to Rebecca, and everyone. Hope everyone has a nice weekend.